Hello everyone, welcome to our channel Small World Aussie. My name is Megha. Hi. It has been some time since I have uploaded a video. That's because, as you may be aware, I am doing a full-time bachelor course in midwifery at the moment. It's 3 years long, and between assignments, exams, clinical placement, continuity of care, experience, I'm finding it a little bit difficult for time. So I have a lot of ideas for videos here. Time constraints are there. Now, coming to today's topic, it is how to answer selection criteria questions for an AIN position within NSW Health. I have 5 questions with me today. The first one is, and I'm sure you have definitely seen this question, consistently demonstrate behaviors that reinforce the core values of our organization: collaboration, openness, respect, and empowerment. Demonstrate these behaviors with all stakeholders, colleagues, patients, consumers, and those that care for them. It's a very long question, but let's break it down. So, before we begin, let's understand the meaning of the words collaboration, openness, respect, and empowerment. This will make it a little bit more clearer for us how to answer this question. So, collaboration is defined as process of 2 or more people working together to complete a project. You should be getting teamwork into your mind. Openness can be defined as being open to new ideas, lack of secrecy, and being frank or honest. So naturally it is related to being honest, sincere, all of that. Respect can be defined as giving regard to feelings, wishes, the right of people. Okay, so I hope you're getting person-centered care, compassion, empathy, all that into your mind. Empowerment can be defined as enabling a person to act on their own authority. So now we have a better idea of what this question requires from us. And I also have an example here of how I would answer that particular question. That is, I have always enjoyed collaborating with team members and colleagues as part of my studies and work. While completing my Certificate 3 in Health Services Assistance, I completed several role plays, group work, presentations together as a team. I understand that effective teams rely on each other, with each member being friendly, respectful, and supportive of other team members. Next paragraph, I demonstrate my openness by offering to help my team members and other multidisciplinary team members, including physiotherapists, allied health staff, ward clerk, etc. An open and supportive communication channel between the multidisciplinary team results in good quality of care for the patients. I respect every individual on the ward, from patients to professionals. I try my best to understand the unique needs of each patient and offer my services to them. I feel empowered by organizing and setting goals for myself. I make my patients feel empowered by making them feel confident in what they do. I make it a point to keep my patients well informed and take decisions which they feel confident about. So by this, you have explained how you have shown, you have demonstrated behaviors that reinforce the core values of NSW Health, which are collaboration, openness, respect, and empowerment, and we have given examples for each. The second question is, Certificate 3 Assistant in Nursing in Acute Care, or current enrollment in and successful completion of at least 2 semesters of a Bachelor of Nursing with satisfactory academic record. I'm going to answer this question. I'm going to answer this as an AIN, that is a person who has done Certificate 3 in Health Service Assistance. Okay, so this is a very straightforward answer. Actually, it's one of the easiest among all the other questions. My example answer is, I have completed all the necessary coursework of Certificate 3 in Health Service Assistance in Acute Care brackets from TAFE and undergone 3 weeks work placement in wherever you have undergone your work placement. I currently hold the Certificate 3 in Health Service Assistance (Acute Care), and that is the shortest way, and it's very concise and short, but you have answered the question. That's more than enough. The third question is demonstrated ability to work under supervision and provide safe, compassionate, quality care that is culturally responsive. So again, in this question, let's take that word culturally responsive. What do they mean by that? So let's look at the definition. Culturally responsive is the ability to learn from and relate respectfully with people of your own culture and with people from other culture. So this is very important to keep in your mind. This culturally responsive part has to be present in your answer, and you have to give examples for that. Okay, so my example is, as part of my clinical placement, I have always worked under the supervision of an RN. Initially, the RN would allocate rooms and let me know which patients to prioritize. After completing the assigned task, I report back to the RN. RN means registered nurse. By keeping the communication open, we were able to remain on top of our work schedule. I am a culturally competent person who strives to give best service to my patient according to their needs. I can respond aptly to emotions, opinions, and requirements of patients from culturally diverse background. So that is how I have included that part, culturally responsive. So my response is that I can aptly respond to emotions, opinion, and requirements of patients from culturally diverse backgrounds. So I have reworded it and used the same, but it means the same. So my fourth question is demonstrated capacity to interact with others in a personable and professional manner and personally resolve conflicts when they arise. I have always found this particular question for every AIN position that I apply. I think this is one of their favorite questions because it's about resolving conflicts and interacting with others. So conflict is a very common thing in healthcare. I guess that's the reason. Okay, so my example answer is, I respect every individual on the ward, and my respect is reflected in the kind, patient, and honest manner in which I interact with everyone around me. As part of my clinical placement, I have had to interact with patients who are rude. In such cases, I remind myself to be kind and compassionate as they are in pain and away from family. There have also been many situations where colleagues that I worked, persons I worked with, lost their cool and behaved rudely towards me. In such cases, I usually took some time out, reflected on the situation, and then approached the person in a calm manner, requesting them for a private conversation. In that way, I can resolve conflicts in a calm and professional manner. So by this, you have shown the person, whoever is reading your answer, that you are a confident and a sincere person. You care enough. If you have troubles, or if there have been conflicts, you care enough that you want to resolve it in an amicable manner. The last question is a thorough understanding of scope of practice and demonstrated ability to work within scope boundaries. So my example answer is, as part of my Certificate 3 in Health Service Assistance coursework, I have gathered an in-depth understanding of the scope of practice of an AIN. During my clinical placement, I was requested by the supervising registered nurse to pass some medication tablets to the patient, but as I was aware of my scope of practice, I politely declined and explained that it fell out of my scope. So the registered nurse understood and apologized to me. Another instance, I was requested by an registered nurse to complete MRSA swab on a patient, but as I was not sure whether it is beyond my scope, I explained to the registered nurse that I will confirm it with the clinical nurse educator, and until then, I will not be able to complete the MRSA swab. I am aware that I am responsible for all my actions as an AIN and confirm to work within the scope boundaries. So that is my 5 different questions and my example answers for all of them. Another important advice is that do not leave any question unanswered in the selection criteria. Please remember that somebody is, when you submit your your selection criteria, somebody is going through them, and you are being marked. Actually, you're being marked on everything. You're being marked in your interview, you're being marked for the way you write your selection criteria. And actually, the selection criteria, your answers to selection criteria depends whether you get a call for the interview or not. So consider them as really important, and it is important to actually put in a good answer and not to leave them blank. Also, do not copy paste from other sites or other, and not these answers. Also, don't copy paste them. Take them, use them, write it in your own words, rephrase them, and add your examples, situations, what happened, and you use them a little bit in a different way. Otherwise, sometimes a lot of you are going to have the same answers. And I hope this video has been really helpful for you. If you like my content, please do remember to share, subscribe, and like. It would mean a lot to us. And I'll see you guys next time in a different video. Bye bye. How I was able to behave, how I was able to